I'm Dr. Rob Zielinski. I'm a medical oncologist practicing in Australia, and I wanted to talk today about the ONCOassist app, which I very much enjoy and embed in my day-to-day practice. I find it an invaluable tool. It's kind of like the Swiss Army knife of oncology apps, because it simply has most of the things I need on a day-to-day clinic timeframe. Particularly, I use every session the AJCC TNM Staging diagrams. I find this such a good tool to have in your pocket. This staging system changes all the time, so it's good knowing that the ONCOassist app is up to date. The other thing, I work as a clinical trialist, and I use two tools quite regularly. Again, the toxicity grading for the CTCAE, which I find invaluable when I'm scoring toxicity gradings. And the other tool I use for clinical trials is the RECIST 1.1 measurement tool, which I find just fantastic having that on the same app as well. The other things I use quite frequently are the formulas, in particular the opioid and the steroid conversion formulas. I find these invaluable. I also use the PSA doubling time formula as I treat a lot of prostate cancers, and it's really good to know the doubling time of a patient's PSA. And the other tool or formula I use quite a lot is the MASCC risk index for febrile neutropenia, as access to GCSF agents in Australia are based on this risk score. So I find that quite useful as well. Finally, the prognostic scores I also find invaluable in my clinic when I'm trying to explain to patients what's the chances or probability of their cancer recurring, such as the Assure tool in kidney cancer. I often use the IMDC kidney cancer prognostic indicator as well. And the third thing I really do use quite a lot is the SINS score, or the spinal instability neoplastic score. And I use this to work out which of my patients need to see the radiation oncologist for worrying bone metastases. And lastly, and again, going back to the whole idea that this app just has it all, is the drug interaction checker tool, which I only recently discovered. And again, it just saves me time not having to go into another website or use another app. And I find this tool very useful and very easy to interpret its interactions of various drugs. So I really love this tool. One other favorite feature of ONCOassist app is that it's constantly evolving. So they're adding new features and tools pretty much all the time. So it's worthwhile diving back into the tool and working out what's new. And that's a really fantastic feature of ONCOassist. It really should be part of, every oncologist's kind of app list. I generally tell all my trainees, if you are going to download one or two apps for oncology, the ONCOassist app really is your workhorse. It'll answer most of the questions you have and find the information for most of the things that they need. So it really is something I'd struggle to run an efficient clinic without. So thanks for having me on today.